So at this time, I would like to introduce Linda Spaulding, who is a registered nurse and certified infection preventionist, and is also a certified hospital emergency management coordinator. She is the CEO and founder of INCO and Associates International, an internationally known infection prevention consulting firm. She has devoted the last 30 years to infection prevention and is a frequent contributor and on the editorial board of Infection Control Today. Ms. Spaulding will present on the current COVID-19 conditions in Florida, along with strategies to confront the COVID-19 pandemic. So with that, I will turn the floor over to Ms. Spaulding.
Thank you, Kevin. I'm happy to be here today. I just have a few slides that I'm going to go through, and then hopefully it'll give you some information related to where we may be heading. On the 16th, I took a look at stuff to put the presentation together. And this is probably just repeat news for the people on the call today. But, globally, there's over 320 million cases and over 5 million deaths. In the US, we have over 65 million of those. And right now we're on track for close to 900,000 deaths pretty soon. I took a look at Florida's new cases as of yesterday, and we had 43,179 cases. That was an increase of 18.6% since the 17th. Now, we don't know how accurate these numbers really are. A lot of the numbers will come from CDC every day, and it just depends on how accurate Florida is collecting the data. So we have to remember that, and we'll discuss that a little bit as we go. I think it's probably the same issue in every state. So some of the things I wanted to talk to today is what's happening in the hospitals, not only here in Florida, but across the country. The first year of the pandemic, I spent in Miami. The second year of the pandemic, I spent a lot of time in Tallahassee. And I've also worked with a lot of clients in Hawaii and in other states also. And it's not as pretty in the hospital setting and the nursing home setting as the news publishes. And a lot of healthcare workers feel if they would just publish more of what's going on in the ICUs of the hospitals, that maybe some more people will connect with that and get vaccinated. But so far, we're just getting what we're getting. CDC guidance continues to change constantly. And as healthcare workers, we understand that because as they get more information from their studies and their research, they have to adjust what we need to be doing as healthcare workers. Well, we can adjust fairly easy to that because we're used to things changing that rapidly. The general public is not handling that very well. And because new information comes out some days on an hourly basis for us healthcare workers, so the general public might get a little piece of that every night on the news, but know that the hospitals have gotten a whole lot more than what's being published on the news. People have just said, well, I'm just not going to do anything. Well, that's the worst thing that we could encourage people to do. And we understand how overwhelming it is. But from a healthcare worker standpoint, our ICUs are full. Our regular floors are now full with Omicron variant patients. Majority of them are unvaccinated. But what's not being reported is we're still losing kids. We're still losing babies. We had a 14-month-old come in to a hospital I was working at. The baby was there for 2 hours and passed away because the parents took too long to get the baby to the hospital. So by the time we got him, there wasn't anything we could do. The youngest child we had was 5 weeks old. And when I left that particular hospital, they had 2 20-year-olds waiting for bilateral lung transplants. That's the information that's not getting on the news to the public because people keep saying HIPAA. Well, HIPAA, you could tell what's going on with people. You don't have to tell them who the person is or where the person is. But I think that information getting out to the general public could change some practices. I was recently up in Ohio. I originally went there to see my family because I haven't seen them for 2 years, and I still haven't seen them because I ended up coming back here because COVID was so bad there. And then people in my own family started getting it. So it wasn't worth me staying there and putting myself at risk when I knew I still had to continue to work. But you'll see parents out to restaurants. Parents are all masked up when they come out of the restaurant. Their children, old enough to be masked, come with them, 3, 4 kids at a time. Not one of the kids have a mask on. So as healthcare workers, we're trying to figure out what is the disconnect here. Parents know they need to have the mask on to protect themselves, but then they don't think about their children. And that's a difficult thing for us to put our minds together. In my own family, we see that. We have little kids and the parents will go out, they'll work all day, they'll have their mask on all day, but then they come home to their families and take their mask off. So I don't know, there's got to be a better way to communicate this. And some people, I don't think we're ever going to convince them that COVID's even real, let alone anything else. But I do think, they're going to send N95 masks out for people now. I'm glad they're going to do it through pharmacies because the people that want them will go get them and use them versus sending them to our houses and having people that don't want them go on TV burning all their masks or something like they've done in other issues in the past. So from a healthcare standpoint, ICU nurses and now floor nurses, they're getting tired. They're putting in 16, 20-hour days, 6 to 7 days a week. The physicians are putting in just as many hours. And, we went into medicine figuring, okay, we're going to see death, but we didn't go into medicine thinking we would see 10, 20, 30, 40 people die every single time we went to work. And that takes a lot out of a nurse or a physician or CNA or whoever else is in the hospital setting. It takes a mental toll on everybody. When I got done at Miami, I had to take a month off just to get my mental health back, that I felt I could go back out and do some more good. I had the ability to do that. A lot of people don't have that ability. And we still have healthcare workers that are living in trailers and hotel rooms because they don't want to take it home to their children. This is the United States of America. And nurses and doctors are getting death threats. They've been yelled and screamed at when they've walked into the hospitals. They're yelled and screamed at in some areas when they walk out of the hospital. It's like, just leave the healthcare workers alone. If you don't think COVID is okay, well, go tell your neighbor or somebody. But for the people that are going to someday probably save your life or try to save your life, that is not the place to be. I was in Texas for a while, the best day I've ever had in my life. We were swamped with COVID patients in the hospital. It was a 10-bed hospital. It was a rural hospital. We had more patients than we knew what to do with. And this one day overhead, it said, all healthcare workers relieve each other, go to the side door of the hospital. There is a farmer here that wants to give you something. You know what he gave us? 2 tomatoes, a head of broccoli, and a potato. That was the best day of our life. And it was weird to say, but it made everybody and myself extremely happy because I knew when I went home that night, I knew exactly what I was going to have for dinner. And it wasn't going to take that long to fix it because I knew I was going to be so tired. All I'd want to do is go to bed. And I never thought to myself that something so small could mean so much. So those are the things that is not getting to the general public for them to understand. Now we have a lot of healthcare workers leaving the field. We're going to have a lot more leave once this Omicron wave comes down. More healthcare workers will leave their job because they just can't take it anymore, or they just can't do it anymore. And people are going to say, well, look at those healthcare workers. They're leaving. They knew what they were getting into. Now, we knew we were getting into taking care of people. We didn't know we were going to get into death threats and yelling and screaming every time we walk in and out of a hospital. So That's pretty much the way it is at this point. I have some nursing homes that I work with, and we're having a problem with staff. They're afraid to come to work, and their family members don't want them to come to work because they're afraid that they're going to bring COVID home from the nursing home and infect them. But what in reality is happening is because of Christmas, because of Thanksgiving, because of Omicron being so incredibly contagious, the employees had celebrations with their families. The employees got infected. Then they came to work and spread it to more of their coworkers and to some of the residents. We can keep people at work safe. They're going to get COVID when they go home and they take off that mask that they wore all day and they sit down with their children that went to school all day, or their husbands or their grandparents who have been out in the community working or going to the grocery store with no mask on, or going to Walmart. I was in Walmart with a friend in Ohio, and we decided that we had to get groceries. So we double masked. We had on an N95 mask and a KN95 mask. So we went to Walmart. The entire store, we were the only two with a mask on. And people were standing there laughing at us and making fun of us, but we didn't care because we knew where they were going and we knew where we weren't. So 2 days later, there's a notice, Walmart closed for the next 3 days. Staff have to disinfect the whole store. Now, anybody in their right mind, how are you disinfecting an entire store? All those shelves, all those products. Essentially what happened is their employees probably had too many employees test positive for COVID, so they had to close down. And they might wipe a few surfaces down, but how do you wipe down all the products and the clothing and the vegetables and all that? They're hoping if they close for 3 days, the virus will die on anything in the store, which it won't, but they can hope that. So it's situations like that. The people that are the meanest people seem to be the ones getting everything that they want to get right now. So then we have a problem with counterfeit products hitting the market. When I was in Texas, the oil fields were closing down. So the oil fields made us a great big tub of a 50-gallon vat of hand sanitizer. Well, that was very nice of them. We are appreciated. But the problem is you can't store 50 gallons of any hand sanitizer in any area safely that it's not an explosive risk. And we didn't know what products were in that hand sanitizer, only to find out reports. Now, that hand sanitizer, I don't know what was in it, so I can't say anything was in it that wasn't good for us. But we started hearing reports across the US that some of the hand sanitizer that was coming out from bars, they were making hand sanitizer because they couldn't sell their alcohol. Everybody and their brother was trying to help healthcare out and make hand sanitizer, but a lot of it had methanol in it. So then healthcare workers and general public started to get really sick because methanol absorbs through your skin and it can actually kill you. So we had that problem. In another place here in Florida, they sent us these bottles of hand sanitizer and it looked like a shampoo bottle. And it was the worst smelling stuff you could ever imagine. And every time somebody tried to use it, they complained that it was making them sick to their stomach just from the smell alone. So we took out the label that was on it. And sure enough, underneath it, it was a shampoo bottle that somebody had refilled with what they were calling hand sanitizer that was making the healthcare workers sick every time they used it. We took it out of the units, and nobody sent it out to get tested to see what it really was. So other hospitals across the country, I'm sure, had the same kind of problems. And then we get this really well-written document that said KN95 masks can be as good for protection as N95 masks. So myself and the purchasing person. We went through, we read all the data, we checked everything out. We couldn't find any issues with it, with the literature. We did our due diligence and more. We spent $60,000 on KN95 masks because we couldn't get N95 masks, only to find out 2 weeks later, they were counterfeit masks and they weren't any better than a procedure mask. $60,000. And we knew a lot of other hospitals had done the same thing. We had the information we had, and that's what we had to make a judgment on. We knew we didn't want people to be without a mask, and there was nowhere else to get any other mask. And of course, they came in from China. So a lot of hospitals wasted a lot of money on masks that ended up being nothing more than procedure masks. There are better N95 masks out there now, but at the time, everything told us that's a good thing. We learned that that wasn't as time went on, and there we had it. So some of that stuff is still happening, and that's why a lot of information is coming out. If you are going to use KN95s or N95s, purchase them from a vendor here in the United States. Prior to COVID, we only had 1 or 2 vendors in the US that actually produced masks here in the United States. So what COVID did bring us is better quality PPE for healthcare workers from here on out, because now a lot of them are being made here in the United States. So all these years of using inferior PPE to try to protect ourselves from TB and that kind of stuff, that's a good thing that came out of having a pandemic. Maybe the only thing so far. And then, so sending COVID tests to individual homes. I like that idea only in the fact that it makes it convenient and more people will test themselves. And hopefully more people that want to stay home and not infect others will stay home and not infect others. But the downside of that is less people are going to be going out to testing sites. And now states aren't going to really know how many positives are in their state because people are testing at home. And if they're positive, they're just staying home and not reporting that to anybody. So I do see that that's going to be the next contention that the news media will jump on and say, well, should we have done this? It will help us get more people to stay home if they test positive. I do believe that. But now we're not going to know what our numbers are like as accurate as we could. Even here in Florida, the governor is talking about stopping testing altogether. If you know you're sick, just stay home until you get better. I can only see one reason for pushing the stopping of testing, and that would be we want people to come here on vacation, and we don't want you to know that we have huge numbers of COVID positive individuals, although that hasn't stopped people from coming to Florida, even when they do know we have humongous numbers. You still go out to the grocery stores here and in Texas and Ohio, and more than 3/4 of the people are not wearing masks. So by distributing free masks from the pharmacies, that's a good thing because we won't be wasting masks. Because if you're not going to plan on wearing a mask, you're not going to go get one to begin with. So that'll be a good thing. And Florida is not the only state that's playing these games. There's many states across the United States that are playing the same game. And the unfortunate thing is this all could go away so easily. Get vaccinated, get boosted, and wear a mask until the numbers start coming down. Once the numbers are down far enough, COVID could disappear. But because we have so many people that won't get vaccinated and won't wear a mask, they say, well, we've lost the fight. Well, you were never in the fight to begin with. You were against it from the get-go. So how do you expect it to go away? And if we have to live with this, it just gives the coronavirus millions of more bodies on a regular basis to multiply, get to know what the human immune system's like, and to come up with a new variant or 2 or 3 new variants at the same time. And I don't see how we're going to get out of this mess if we're going to continue to have people be in the incubators of the virus. And it's not only here in the United States, it's across the world. So even if we got it under control here, then what happens in England or Germany or Iran, Iraq, Japan, China? All they need to do is to have that super variant come up, and it's going to be here before we even know it's circulating. So that is the healthcare people's real concern on what this variant of COVID can do. And I don't know why everybody thinks this is a 5th spike. Why do they think this is the last spike? You know, prior to Omicron, we thought that was the last spike and we would be getting back to normal very, very soon. So people came out and said, I'm going to get back to normal, end of story, period. And then Omicron came, that's even more infectious than Delta. And people are acting as if Omicron doesn't even exist out there. So we're doing less for a more infectious variant than we did with the original variant, that had we controlled that, we never would have got Delta. We never would have got Omicron. I don't have a real comfortable feeling that Omicron's going to be the last one. So now we're seeing our kids, our little ones that can't be vaccinated. Pediatric hospitals are full with the pediatric patients. This hasn't changed a lot of the public's ideas either. And so now hospitals are starting to gear up in 4 to 6 weeks from now, seeing a lot of those kids that had COVID 4 or 6 weeks ago coming back into the hospital with MISC, which is a multi-system inflammatory syndrome. It looks like the child just has their body is scalded. It looks like they have one great big burn over their whole body. They get really red, they get high fevers. And if pediatric docs that aren't working in the hospitals aren't able to pick up that these children have MISC, then there's going to be some bad consequences from that. So I think we still have a lot more to come. It hasn't gone away. It's not going to go away this year. And if we don't get more people vaccinated and more people complying with masks, then I think we're just going to sit back and wait for the next wave and see what it is and what it does. The only problem is we're going to be having less healthcare workers if that next wave comes our way. And we're going to be in worse problems than we are now. When I was in Ohio, we had a person that had a heart attack. His mother took him to the hospital and he sat in the emergency room and completed that heart attack because there was no other hospital to send him to get a cardiac cath, to either go to open heart surgery or to get a stent in. He sat in that emergency room and just finished having his heart attack. And then a week later, they found a hospital about 3 hours away. They sent him to. He had a cardiac cath done and he had to have a stent put in. This is the reality of what healthcare workers are having to deal with. We all know he should never have sat in that emergency room. He should have been in a cath lab within an hour, the stent in within the next hour, and it would have saved a heart muscle. But because we have too many COVID patients and no beds open, those people that don't have really bad COVID are the people that are having bad consequences because of that. And the health system can't figure out how to fix that. You have no beds, you have no nurses, you have no doctors. What's coming in the ER door next? It's extremely stressful and hard to deal with. So I just had a couple more things that I want to bring up. And then if anybody has questions or anybody else wants to talk, I found this document. You know, there's a lot of rapid tests out there. And these are how the rapid tests rate. And so if you've used a rapid test and you know which one of these they are, you'll know how good of a rapid test you had in how accurate it may or may not have been. When COVID first started, all the nursing homes got this BD vector kits. They were marginal at best. We kind of thought that at the time, but that's all the testing that were on the market at the time. So a lot of rapid tests were done on nursing home patients were inaccurate. And that's why COVID probably got out of control in some of the nursing homes. And even to this day, hospitals are getting all the funding for PPE and everything. Nursing homes are getting nothing. Hospitals are getting all the staff flown in to help them take care of the patients in the hospital and the militaries. Nursing homes are getting nothing. I cover actively during COVID, I've been covering about 5 nursing homes. We have been short-staffed so many days, and with Omicron, it's even worse. And we call on a daily basis, Department of Health, the hospital associations, everybody that they can think of to get more help. And they said, sorry, we don't have any. We have to give it to the hospital. So nursing homes right now are stretched as bad as the hospitals. And in some of the cases, they're stretched even worse. We were lucky until right after Thanksgiving. We hadn't had one COVID resident in those 5 nursing homes. After Thanksgiving, we have so many staff now that has COVID, and CMS won't let us prevent visitors from coming in. So visitors, we have to let in to see their loved ones at the same time that we have staff out because of COVID, and visitors who might have COVID coming in to visit. And it's yet to be known what's going to happen with that. So this is another website. Remember, I was talking about the N95 mask. If you want to know if the N95 mask that you recently purchased is counterfeit or not, this website is a great website. It has a picture of all the counterfeit masks, and they updated, I think they update it every day. So if you want to make sure you have a good quality N95 mask, try to buy ones that are made in the US, not stocked in the US, because we bring a lot of masks from out of the country, give it a distributor here, and then those distributors hand it out. It doesn't mean it's not from another country. It just means we're the holder of the mask. And if you say you want 100,000 masks, we're going to send you 100,000 masks. So you really have to ask the question, is it made in the United States? And that's all I have.